Good morning. I'm Hernando County Sheriff Al Nienhuis. It is Friday, May 1st. It's 9:30 a.m. and we're here with our live broadcast, Facebook broadcast regarding the coronavirus here in Hernando County. I'm joined here today with our County Administrator to my left, your right, Jeff Rogers. Welcome, Mr. County Administrator. The Chairman of the County Commission, John Mitten, is to my right, to your left, and to my far right, Robin Napier. She is the Administrator here in Hernando County for the Florida Department of Health. She works for the state of Florida for the Health Department. I know last time, a week ago, we had a lot of questions about testing and things like that, and she should be able to answer those. Again, feel free to share this with your friends. We certainly want to get the word out. Your leaders here in Hernando County want to get you as much information and be as transparent as we possibly can regarding this coronavirus. I do want to turn it over because there was such interest last week about testing. I'll turn it over to Robin in a second, but a couple ground rules. First, we'd really appreciate it if you would keep your questions to the coronavirus, particularly as it relates to Hernando County. We'll try to answer some questions about state and national issues, but we really want to keep it directed to issues here in Hernando County if we can. Also, if you could do us a huge favor, if you post your questions, we have a few people that might actually even be able to answer them typing. We'll try to answer them verbally, but last time we had several hundred comments. There's absolutely no way in a half hour we could even begin to address this, so please be patient. I would appreciate if you wouldn't post the same question over and over again so that we do have those individuals who do want to get a question across, give them time to get their question, and hopefully we can answer it. So I'm going to turn it over before we do anything else, turn it over to Robin Napier. She's the administrator here for the Florida Department of Health in Hernando County. I know you have been extremely busy over the last month or two. We certainly appreciate all you do. I know I've emailed you a couple times and you've always been quick to answer to get information out to the public regarding especially regarding testing and people showing positive results and so forth. So if you could talk a little bit about testing and maybe even give a little bit of the status here in Hernando County as it relates to where we stand with testing, as well as those that have tested positive and those who've been removed from isolation, that type of thing.
Sure. Currently, the Department of Health is following the CDC guidelines for testing here in Hernando County and throughout the state, which means we will test you at the health department if you're symptomatic. Tested total in the county so far was 1,687 people. We have a 5% positivity rate, which is great for Hernando County. That means that the majority of people tested negative. We have a total of 91 cases in Hernando County to date, 85 residents and 6 non-residents. We have had 5 deaths, unfortunately, in the county. Currently, we only have 1 person hospitalized as a resident. Cleared from isolation, that's a term I know that people may not understand, and basically what that means is if you have if someone was tested positive for COVID-19, the health department follows those people very, very closely, and if they have at least 7 days since symptoms first appeared and at least 3 days since no symptoms, we call that cleared from isolation. So in Hernando County, out of the 91, 85 people have been cleared from isolation so far, so I think we're in a good position as far as that. They are looking, the CDC is looking to expand the criteria for testing, but we don't have any information on that currently, and I'll be glad to put that out as soon as we do get that information.
Very good. Thank you, Robin. Also, I know our county administrator's been very busy, and our chairman of the county commission. I'll turn it over to the chairman first. If you have any comments you'd like to make there, Chairman Mitten.
Sure. Thank you. I appreciate you hosting this and everyone participating this morning online. I think we're at a place where we're really excited about Monday. The governor's come out and he's given his plan forward, and we're going to be opening up businesses, retail shops, and restaurants at 25% with the social distancing, with those CDC guidelines, and we're excited about what that looks like in Florida, certainly Hernando County. There's a lot of questions out there regarding what does that look like, and so as you're posting them, we're going to try and address some of these things. Mostly what's going to happen, though, is if you have that 6 foot, that social distancing, and you have those CDC guidelines of the groups of 10, etc., I think you're going to be able to do the things that you need to do as those stores will allow you per capacity. So we're real excited about that and looking forward to Monday. It's going to be a different and welcome phase, but it's something that's going to take time to wait for the data to come in and see, have we gone too far with this? I don't think so. I think the governor's been able to listen to the experts. He spoke with the hospitals around the state. I think this decision to go with 25% and move Florida forward and Hernando County forward at 25% is a good shot, and we're looking forward to that on Monday.
Very good. County Administrator Jeff Rogers, if you'd like to give us a few words.
Well, I think we've covered the majority of these things. I think obviously we're looking forward to Monday of these rules opening up. For a few of the things, elective surgeries now can go forward as per the governor's orders, and so then also restaurants are available to open up with outdoor seating capacity, and then 25% of your inside seating capacity is allowed to open up with proper social distancing and sanitization methods that have to be applied, and also retail. So retail is allowed to open up at 25%. Chairman, one of the questions I've seen already is, does this affect county parks? This does not affect, this change will affect county parks. The county parks have already been reopened by the Board of County Commissioners last week, and so all the county parks, including Pine Island now, are open for your use, including the playground to this county, and so those are opening at this time.
I did see one question. Somebody mentioned something about removed from isolation, and that once they're removed, they could be asymptomatic and still spreading the disease. Maybe you could address that. Do they get retested, or is it possible for them to spread the disease, or is it likely that they would spread
Well,
it?
currently we do not retest after someone's positive. We do use the clear from isolation. The reason we do that is we're focusing and we're wanting our test kits to be on those that are the sickest, those that are symptomatic. So we do not retest. We look at a non-test based strategy for that, which is meaning that if they're not symptomatic in those 3 days that they are cleared. It doesn't mean that some people aren't asymptomatic, but we are currently just not testing for that based on the number of test kits available. It's not that we're short on test kits, but we're trying to focus and save those for those that are needed the most currently, which are those that are sick or symptomatic.
And I know a lot of people are concerned about obviously spreading the disease. We want to look at the positive. I think that right now you said that there are currently how many people in isolation? About 6 or 7?
6.
6 in Hernando County. So there's 6 people right now in Hernando County that have tested positive that are still in isolation. Some people might say they're still sick, for lack of a better term. They haven't recovered, but that's not the term that the health department used. But that is excellent, excellent news. If we were not doing things right, I think most people would agree that we would have a lot more than 6 people right now still in isolation. Now, again, I know people talk a lot about we're not doing enough testing and so forth, but you have to keep in mind that we're testing the sickest people, the people who show symptoms, and about 95% or a little bit less are coming back negative when they're tested. That's correct. So again, a very good sign. We're not saying that every person in the county has been tested. We're not saying we've caught every single person that might actually have the test and been tested. But I think the statistics, based on what tests they have available, I think the statistics are very good, which means our Hernando County residents are doing the right thing. They're staying 6 feet apart. They're washing their hands. They're staying home when they don't have to go out. They're not getting in groups of 10 or more. I did see somebody mention face masks. Of course, Robin, if you want to jump in and talk about this, face masks right now are voluntary, and I think mainly everything I've heard, and correct me if I'm wrong, Robin, is really mainly to keep you from spreading it, to keep any virus that you have in, not necessarily so much to keep you from catching it from other people. And so it is right now voluntary. Particularly if you are somebody who may be more concerned about, you have a cough or things like that, I would definitely, I think most people would agree that you should wear the mask. If you're concerned, it certainly is not going to hurt you to wear it, and it may help you prevent it from getting it in certain circumstances. So I don't think we would ever discourage anybody from wearing it, but right now they are voluntary. Of course, there are a lot of businesses now that are making it mandatory for their employees to make the customers feel more comfortable. Obviously, that's not a bad idea, but you get to pick and choose which business you use. So if you're more comfortable going to businesses that have masks, then by all means, go to those. So I see some people talking about being sick and not getting tested. Again, we could talk about that a lot, but even the people who were sick and traveled and all that, about 95% of them came back negative. So you know, your chances are about 5 in 100 if you fall into that same category, all else being equal, of actually having the virus. But again, if you're sick, stay home. Assume you have it and you know, act accordingly.
Well, and the other thing you can do, if you are sick, you can contact the health department. You can call us, and we will have a nurse triage you to determine what your symptoms are, if you are eligible for testing. So certainly feel free to call the health department and have a nurse triage you if you are sick.
And I think as you look at the testing, weeks ago, we didn't have the supply to be able to test as often and as many people as we desired. All those went to those troubled spots and those places where the virus was really beginning to break out. As more tests are available, then the criteria we can now expand and test more people. So I think it's going to be a lot easier to get testing in the future before and depending upon how much supply, we can even have them tested again afterward, as they're testing in many states.
Yes,
so.
That's correct.
If I can answer a lot of questions coming in, which is great, and some of these I'll answer a couple of them. I think Pine Island, we talked about being open already. Somebody asked if Pine Island is open. It is open now. I was actually there last night, and it was great out there. Windy, but a lot of waves last night, but it is open now. Weeki Preserve, you know, that is Swiftman, Southwest Florida Water Management District is oversees that. I've been in contact with them. They are discussing it right now to see when they're going to open. No dates yet, but hopefully soon. They're reviewing that to see when they're going to open that up. The governor is opening some state parks. But the local agency is reviewing that right now. I saw a question about dentist office on there. Dentist office is included in this. Is that elective surgery areas that can open, so it's up to the individual dentist office. But with proper guidelines and everything, they are allowed to open at this time. So you can call your dentist, see if you can get back into that schedule and get those things taken care of for you. And lastly, I saw a question on DMV about testing for driver's licenses and your expiration of your license. I did see, I believe that there is an extension going forward where these driver licenses are not going to expire. Sheriff might know about a lot of this than I do, but yeah.
Right. Obviously, the deputies, if your license is just recently expired and it's not suspended or anything like that for other reasons, I think most of your law enforcement officers are going to use some discretion and in that case. But right here in Hernando County, our tax collector, Sally Daniel, is doing a tremendous amount via mail and online. You should be able to just Google Hernando County Tax Collector or use a search engine, and you can get emails there and email them or call them. I'm sure they'll be more than happy to help you out. I do know that they just recently got some face masks from the sheriff's office, so I think they're gearing up to start opening their lobbies up again for physical contact. But again, I would contact them, and they can probably help you. In most cases, they can probably get you taken care of, unless you're a real unique circumstance where maybe you need a behind-the-wheel test or something like that. Hospitalizations, I noticed somebody said something about 6 hospitalizations. If you look on the Department of Health dashboard,
Correct.
that's the cumulative number that have been in the hospital since the beginning. Is that correct, Robin?
That's the number of people that tested positive that were admitted to the hospital at any point in time. It's not the current number that is in the hospital. So,
And do you have that number? Is it roughly 1 or 2, or?
we have 1 resident in the hospital.
One resident of Hernando County in the hospital right at the moment, but it looks like we've had roughly 6 if the person asking the question was correct.
Yeah, that number again, just remember that's if anyone tested positive and they were admitted into the hospital, that number's going to increase, but it doesn't mean they're still in the hospital.
Somebody asked a question about churches be open. Again, the governor early on mentioned that church services were essential activities, so they've always been able to do that within reason. I think most of our local churches have been very cautious, because even the governor spoke a couple nights ago about a spreading event that happened at a choir practice, where I think I read 40 to 50 people actually caught it and 2 died. So you certainly, if your church or your business doesn't want to be in the news in that way. So we still need to use those guidelines, try to stay several feet apart. Again, if you're going to be singing or anything like that, there might be some more likelihood of catching it. So again, but bars right now, bars and personal hygiene type places like barber shops and hair salons are still not able to be open. We appreciate the comments.
I saw one for the food trucks. Out there is that I believe those you need to contact the Department of Business and Professional Regulation to make sure how you're registered. But if it's a restaurant, it's a restaurant and it's outside seating, then you see these food trucks are allowed to operate. But double check with the DBPR has licensed you to ensure that you're authorized to operate. But obviously outside seating and then safety guidelines in place
Right.
also.
I think at the County Commission yesterday, you brought up a good point. I think most government agencies really want to work with businesses and get them open. I don't think there's a leader in the state that is trying to withhold businesses from open. But as the governor said, we have to be safe, we have to be smart, and we have to do it step by step. So if you're a business and you're thinking about doing something creative, it never hurts to reach out to the Division of Hotel and Restaurants under the Department of Business and Professional Regulation. If you sell alcohol, you may want to call alcoholic beverages and tobacco just to double check. But I know your commissioners here in the county and your county administrator, and I think I can speak for the city. They want to do everything they can to help you get up and running as quickly as you can. Outside seating sounds like a really great idea, but we still need to, we need to be cautious, move cautiously, get information. If you're going to do anything out of the ordinary, it never hurts to double check. I know a lot of these government offices are very busy, but they should be willing to help you out. So.
I think that's in key what the governor has put and what he hasn't put. From the beginning, he said that church services can have those services. They need to have the social distancing in place. They need to have the grouping in place. The same goes for now. Businesses are going to be opening next Monday, but in summary, so that there's clarification, there are 3 types of businesses that will not be opening on Monday. That are the bars, the gyms, and those that provide the professional services, like the hair salons. And so those have yet to be released. That could be a couple weeks. He hasn't really given us any time frame for phase 2, what that looks like. And the reason is because the testing and the timing of this virus to be able to react to our measures and our steps takes some time. And when he's able to look at that data and go, we've not released something above what we're desiring, we still have it under control, then I think he'll look strongly at that phase 2. You have to remember, the reason why we went to these restraints was so that our hospitals weren't overrun. So we had the right ICU beds, we had the right ventilators, we had enough capacity in our hospitals. That's why he spent the time going to all the different hospitals and spending time talking with the professionals. So between the experts in the field and between our hospital capacity, we feel like we can do this 25% with these businesses and get to that next phase as soon as we possibly can. Thank you again to Hernando County. It's been mentioned time and time again, being posted, how good Hernando County has reacted to this virus. And it's because everyone out there has done a fantastic job at abiding with safety and prudence. We have loved our neighbor by staying away from them, and we've done a great job. And so I don't suspect there's going to be any issues, whether it's on the beaches, whether it's in the stores. I think we're going to be able to activate this as we have the other restraints. Phase 1 is going to look good in Hernando County.
Absolutely, and I saw one person ask about Crew Motorcycle Park. That is, I believe that's going to be a state park, and they're opening those up a little at a time. I would do a search engine on state of Florida state parks, and I think they're having a list of those that are opening. Hopefully they'll get some information out to you. My guess is that those will probably open sooner rather than later under the governor's orders, but again, that's going to be the state of Florida. I know that we've said this over and over again. Hernando County's been doing great, but we all have to take individual responsibility. And if you are concerned, if you think the governor is moving too fast, obviously there are about 50% of the people think he's moving too fast. The other 50% of the people think he's moving too slow. We certainly understand that because there are very strong arguments on both sides. However, if you're concerned, you can still keep doing exactly what you're doing today.
Correct.
On Monday. You can stay home. You can stay, especially strangers, you want to stay at least 6 feet away, maybe further, because you don't know when somebody's going to cough if you haven't spent any time with them, and that's where your real danger comes in, is those particulate matter that comes out of somebody's mouth or nose if they cough or sneeze. Stay 6 feet apart. Wash your hands frequently. Go to those stores that offer pickup rather than having to go in the store. If you're concerned about going into a grocery store or a department store, there are several of them that have, even before this virus, had the ability for you to order online and go pick it up without even really having to go in the store, or if you do have to go in, you don't have to go in very far. So again, please just keep that in mind, that you don't have to do anything that you're not doing today. I see there's a big question about VFW and private clubs. I would talk to the Division of Alcoholic Beverages and Tobacco about that. That's probably going to be considered a bar, but we'll let the experts at the state of Florida determine whether a VFW, particularly if you have an alcoholic beverage license, you probably have what we used to call an 11C license, which is a club license. My guess is that they're probably going to consider you to be a bar, but don't take my word for it. Call the Division of Alcoholic Beverages and Tobacco. You can do a search engine for DBPR, and you can get the information there. I think there's some telephone numbers on there, and they can give you information about that. So,
a couple questions. I saw that county offices and the city offices had a question on when they're going to be opening up. I would tell you for the county offices, almost all of our services are available now online. They have been through this time when we did this social distancing. We're making steps now to provide a safe environment for us to open back up to the public in a physical environment. But right now, if there's any services you need, you can call, and we will be, everything can be done remotely. And that's the same for the tax collector we talked about earlier. While there's some things with licensing and things that you can't walk and do today, almost all those services are working with you. You just need to call them, the employees are there, and you can work and get through a lot of those issues, except maybe the driving test. I think right now is a struggle on how they do those driving tests at this time. So that's something, unfortunately, those that have turned 16 have to wait a little bit longer to get that driver's license right now. But
I think some of the questions that you're seeing are a result of the uncertainty within the orders from the government with specifics. Here's what I would say. If you take what they have said, the CDC guidelines, and you have, whether you're at the beach, whether you're at a restaurant, whether you're at the supermarket, whether you're at your apartment complex, whatever it is, if you maintain social distancing, and you maintain, if you're sick, stay at home, you have the washing of the hands, you have your wipes with you, you have your groups that are less than 10. I would say that unless it's specifically prohibited, venture out, go live, go have fun, go to work, do what we do, but do it with prudence. And what I would say is if you're in a private organization, then you go, and maybe that apartment complex or that condominium says, I can't go there. Well, then fine, you abide by that. That private business that maybe they don't, some of these bigger chains, frankly, may not be able to activate with all of their POP and all their resources. They may not feel comfortable starting on Monday. You may have a much more nimble, smaller business that can activate that quickly. So I would go to those places. I would practice your CDC guidelines, practice prudence, and then have them prohibit you from doing more.
Yeah, and again, the big thing that the governor was concerned about, obviously because he specifically mentioned it, were those retail businesses that previously were not considered essential can now open.
Correct.
But you can have to do it at 25% capacity. The same thing with restaurants. The interior of the restaurants, 25% capacity. And the governor was very, very clear, and I think this shows leadership on his part. He was going to look at the data. He's not going to be swayed by emotions.
Right.
He's going to look at the data. And if opening 25%, we don't get an overwhelming number of positive cases that starts to stretch our resources as far as hospitals, as Commissioner Mitten said, then I would venture to say sooner rather than later, we'll move into phase 2, again, as Chairman Mitten said. So again, if you're talking about pools and things like that, talk to your condominium association, your homeowners association, or whatever, see what they feel comfortable with, because maybe their insurance company, and I heard you mention this yesterday, it was a very good point, the insurance company may not want them to open, so it may not be somebody who's just trying to keep you away.
Right.
Sunbathing I saw somebody mention something about sunbathing at Pine Island Park. Obviously, that's not a concern as long as the park's open, as long as you maintain your social distancing, particularly from strangers. That's going to be the critical thing. Is when you're in those parks and out in public, try to maintain social distancing, particularly from people that you don't know, that you don't work with, that you don't live with, and so forth, because you never know if that person might be sick.
Sheriff, I saw just a couple questions I think we all noticed, but we did see barber shops and hairdressers that they are not open at this point. We're hoping with phase 2, they are in the phase 2 plan, so as soon as we get to phase 2, looks like, so I would tell them to start making recommendations on how they're going to open in the near future. I did see a question on travel. The governor has not relinquished his travel issues, so there is no, there are certain hotspots in the country that cannot travel to Florida. If they do travel to Florida, there's a 14-day period where they have to stay in isolation for that point in time and monitoring. And so I would tell you the travel is not, and it is stay-at-home order. So the stay-at-home order was extended till Monday at this point through that order. Then that order basically goes into this new executive order. So stay-at-home order is not lifted. There's a few more restrictions that have been released, but overall the idea is if you have non-essential activities, we should not be doing non-essential activities continuing. We're allowing you to do all these things, but at the end of the day is that whole idea of non-essential travel is still trying to minimize part and minimize the infection growth in our community is still going on.
And I think that's a good point. As we opened this up, we said the governor's going to be looking at numbers. One of the things I think we can do is be very cautious of interacting with family and friends that have to travel for essential things. If your loved one is a truck driver that goes to a hot spot, whether it's Miami or New York or some of these other areas, you need to be especially careful, because that person that's exactly how it was brought into Florida, how it was brought into Hernando County. It didn't just appear here, it was brought in by somebody traveling. It doesn't mean that we need to necessarily alienate these people, but we need to be much more careful of those individuals that are moving from county to county, because right now with only 6 people positive, that's a great thing, but as we open up, there's more of those people. We could have 0 cases here. We could test everybody in the county and have absolutely 0 cases today, and have somebody could bring it in tomorrow. So I know there was a lot more talking about testing. Again, they're opening it up. Many private labs make testing available. Your doctor might be able to get you private testing. If you really want to be tested, just keep in mind it's only good for the time you get tested. The very next day you can catch it. So again, unless you're talking about the antibody test, we're not going to go into that. That is way too complicated for what we have. We don't have a lot of time yet, but if you want to get tested, see your doctor. The health department has only a very small number of tests compared to the 200,000 people in the county. But keep in mind, the more tests that are put into these labs, the longer it takes to get those tests back. And I had an administrator from a couple hospitals say that early on they were waiting 2 weeks, 10 to 14 days to get tests back. Well, of course, that doesn't do Robin any good at all if it takes her 2 weeks to get a test back. So that's the reason. I know everybody's frustrated about testing. I know everybody from the president down to the local health department would love to get everybody tested and be able to test them every single day. It's just not practical. This is not like taking your temperature. It takes time to get those results back. And the more we put in, obviously the longer it takes to get them back out. So we're almost out of time. I'll turn it over to Robin. Is there anything else you want to say, Robin, from the perspective of the health department?
I just say if you have questions, please don't hesitate to call the health department. We are more than glad to answer any questions that you have. If you have symptoms, please come to the health department to be triaged. And again, as Mr. Mitten said, it's all about really continuing these safeguards that we've been doing all along. Please continue to do those, and I think Hernando County will fare well, as you said, in phase 1 and move to phase 2 quickly. So please continue to social distance, and if you are sick, please stay home.
Go ahead, Chairman.
Proud to be going through this with you. Thank you, Hernando County. Great job.
Excellent. County Administrator?
I'll just see if there's any questions that are not asked today. Last one I saw, that libraries will be opening within the next week for the county. And any other questions that didn't get answered, please send those questions to us. And the county staff, the sheriff's office, the health department will get those questions answered for you. And we'll all go through this together.
Yeah. One last thing, we did see, questions about the 25%. Businesses just need to do their best. Try not to push the envelope.
Right.
There is nobody that's going to come in, and if you have a capacity of 100 and you have 26 people, we're not going to be taking anybody to jail, but just try to do your best. I think if people are trying to work within the law and trying to follow the governor's orders, nobody's going to have any problems.